All right, we want to talk to you about mediums, okay? Mediums being, say direct mail, radio, TV, and so forth, internet. Is it the case that one medium will support another medium? For example, does direct mail support your website hits? Well, the answer is yes, it does. But are there other mediums that support other mediums?
Yep.
What do you think?
All right. The internet, your website, supports every external promotion you do from this point forward.
Yeah.
Ever.
Yeah.
Okay? You can study it statistically if you go look at your Google Analytics report and you see the non-referred. In other words, they didn't come from search engines. If you look at that number of people who visit your website, those are people coming from your advertising. They physically typed in your domain. They didn't have to search for it. They typed it in.
Right.
Okay? So from that aspect, the best medium that supports not only itself with SEO, but supports all future advertising that you will ever do will be the quality of your website.
Exactly.
Okay? If you do them together, which is what we do,
yep.
You then, I'll just use mail and a website together as a pretty classic example.
Yeah.
Okay? When you send mail out, you have a very specifically targeted group of recipients. They're targeted by 4 criteria, which we're going to get into in another segment. But you put 4,000 or 5,000 pieces of those on the street each month, and on that piece is your web domain, and on that piece, we are making the case to choose you. And on that piece, we probably highlight 6, 7, or 8, maybe even more of your most primary marketable attributes of your dental practice. So let's say that's all set up. A certain number of those moms are going to call right off the phone number, right off that mailer.
Mm-hmm.
They're not going to go to your website first. But one of the cool things that we know about the top half of the dental market is those moms are very research-oriented. Those are the moms that go to WebMD. Those are the moms that they're going to find out as much information as they possibly can before they make their choice. The reason I'm saying this is because part of what we do at the firm is we orchestrate everything. Okay, so if we're doing the mail and we're doing the website and we're doing, the SEO and the radio and the TV.
We're in complete control.
Yeah, well, you know what tripped their trigger off the mail.
Yeah.
So you know what to immediately present on the website.
Right.
So when people look at our mail and they look at our website and they see a similarity to them, there's a reason for that, because you interested mom, she went to your website, you need to show her more information about what interested her in the first place.
Right.
Okay? So she sees what she's looking for right there on the homepage, and she clicks on it.
Right.
And she learns more, and always the conclusion on the website is, we don't know if you're a candidate for this, but give us a call.
Yeah.
Okay, come on in, get to know us, and we'll take a look-see.
Right.
All right? So.
Now, yeah, and we see this all the time too, is that the dentist wonders if he's getting anything from his, for example, his mailings, right? Because, all of a sudden there's this surge of interest being generated from his website.
Right.
So he thinks, well, I'll cut back on the mail and I'll beef up the website, et cetera, et cetera. That's usually a mistake, because the reason the website is garnering that much attention is because of the mail.
Right.
They do support each other. So, and when you ask a patient, how did you hear about us? And they say, oh, I went to your website. Okay, but why did they go there? Well, I got the mailer and it said, so I went.
Right.
So it can get kind of confusing as to what medium is producing what numbers. But they definitely feed off each other and support each other.
Same thing with radio. Same thing with radio.
Yeah.
If you're doing, same thing with television. If you're doing a radio ad and you're doing it right, and you're rotating your single topics through, let's say you produce 5 ads. One of them on sedation, one of them on 6-month smiles, one of them on sleep apnea, implants, whatever. You pick the 6. And you rotate them through your ad time. I guarantee you at the beginning of that ad and at the end of that ad is going to be your website URL.
Yeah.
Okay? Well, if you don't have those 6 things immediately found on your website, they're not going to look. They're not. The dental consumer Just the fact that they went to your website is cool.
Hallelujah.
Okay, hallelujah. All right, but if you hide what you're advertising on radio, that's not going to help you.
Hiding it under a services tab.
Right.
And then they have to click on that, and then they have to look
services,
for
family,
6
sleep
months
apnea.
Yeah.
And they're never going to get there. So you're all this stuff. I guess our point is all this stuff. All of it has to be done properly, and it all has to be coordinated, or it doesn't have to be, but it should be as close as possible.
Yeah.
And you know, even if you already have a site and it's not quite perfect, as long as it's not like really bad, okay, you're fine.
Yeah.
You're fine.